Hello, good morning viewers. So here we go with our again new session and discussions which we continue regarding the same topic which we are doing before.
Yes.
So we have some more questions we already write here, like regarding our previous video, some questions the people said that we need to ask you again.
Yes, please.
So regarding we have some 5 questions. First of all, the question they give me like, do you need anticoagulant during your cardiopulmonary bypass?
Yes, of course, without the anticoagulant bypass is not possible. To run a cardiopulmonary bypass is not possible without anticoagulant. So the anticoagulant we are using during the cardiopulmonary bypass is heparin. So we are using the heparin as a anticoagulant prior to initiate cardiopulmonary bypass.
So what dose of heparin do you need? Like regarding your cardiopulmonary bypass procedure, you have any specific dose range?
Yes, of course. Yes, of course, there is a dose. Prior to cannulate the patients from anesthesia side, anesthetist, they induce around 300 to 400 units per kg, the dose of the heparin to the patients. It depends according to the protocol of the hospital, but ideally is around from 300 to 500 unit. In between that, every hospital have their own protocols. So this is the common ranges of the heparin we induce as an anticoagulant.
So I have one more question regarding the same, continued about the anticoagulant. Like what test basically you use to monitor about the range?
To check the bleeding point of the blood for cardiopulmonary bypass, we required a test called ACT. ACT means activated clotting timer.
Yeah.
So this is the test we used to do for the bypass. To initiate bypass, we required an ACT test, and the baseline ACT prior to the heparinize the patients before giving to the heparin is around like 100 to 150 seconds. So this test is in a seconds. So ACT, we have the test called ACT.
So okay, so you have a scenario like, if it's ACT is below, so what will you do and what is the procedure?
First I just want to add one more point here.
Yeah.
The ranges of the ACT. What is the ideal range of ACT to go on a bypass?
Yeah.
So the ideal range of the ACT is it should be more than 450 seconds to initiate bypass. If it is below than that, we will not go for the bypass. We need to add more heparin. Or if it is 400 and above, yes, we can go on a bypass. So now what is your scenarios as you asked me again, please?
The scenario is like if the ACT is below, so like what to do?
If ACT is below, then the required, we give additional dose like 50 to 100 unit per kg. But if still the ACT is below,
yeah,
so then it's mean that we need to check the vial. Maybe the heparin vial, the drug vial is expired. Or number 2, the route of your administration of your heparin. Maybe you are injecting heparin not to the patient, is going on the table. Maybe the 3-way is opened and is not flushing into the patient. Number 3, maybe your machine is not properly calibrated and the result is the fall. And number 4, sometime the patient's having like a antithrombin 3 deficiency, because the heparin is going to affect on the antithrombin 3 factor. So if the factor is, there is a deficiency of the factor of the blood, then for these reasons we need to do to add 2 units of the plasma, fractionated plasma, so to increase the factors of the blood, and then we repeat the ACT. And if it is ACT go above than the 450 seconds and above, yes, we can initiate the bypass.
All right, thank you for guiding about the heparin and anticoagulant, the role in a cardiopulmonary bypass. Thank you
so much, and have a good day. Take care. God bless you.